Hi, my name is Suhak Patel. I'm an interventional radiologist at Tanner Health System in Carrollton, Georgia. Interventional radiology, IR, is kind of as it sounds. Part of it's radiology. Everyone's familiar with X-rays, CTs, ultrasounds, and MRIs. These things allow radiologists to see inside of a patient, diagnose diseases, and treat patients without ever seeing them. And what interventional does is we actually use that to our advantage. We're able to use all these different X-rays, CTs, ultrasound, whatever, to allow us to treat patients in a very targeted, minimally invasive way. We treat a whole host of diseases, both benign and malignant. So we go almost everywhere in the whole body. So this includes, like, for benign diseases, we might be treating kidney stones, we might be treating blockages in the kidney or blockages in the liver. If there's a trauma, then we're able to, like, for instance, if there's a car accident, there's bleeding in the spleen, instead of a general surgeon having to come in and make a large incision, I'm able to make a small incision in the groin, use some catheters, some wires, go to the actual artery that's the problem and block that. And this is all done with the tiniest of incisions. And we also treat malignant issues as well. So this goes from biopsy all the way to the treatment. Treatments include, if there's a tumor, for instance, in the lungs or the liver, we're able to put small needles into them to burn or freeze them. I'm able to go to the arteries to supply tumors and inject chemotherapy directly into them. The great thing about minimally invasive procedures is that the recovery times are very short. I would say that, the vast majority of our patients are coming in as outpatients. We do the procedures, and the vast majority of them are being released or are going home about 2 hours after their procedure. Having interventional radiology at Tanner's, I think, huge for this hospital and for the community, because we're able to not only provide 100 different extra procedures that we're going to be able to do, but we'll also complement the services that are already provided here. And this will mean that patients can get the same high-level, minimally invasive care that they would get in a large city right here in their own community. What truly excites me about having interventional radiology here at Tanner is that we have such a great team. We have nurses, technologists, nurse practitioners, and physicians that are great to work with. And I know that we do our best for every single patient that comes through the door. We have patients that come in nervous. We try to do our best to answer every single question that they have. We try to explain what they're getting done. And a lot of the procedures that we do are advanced procedures. And we try to make sure that patients truly understand what we're doing for them and the risks and the benefits involved with everything. And I try to remind patients that they have a whole team dedicated just to helping them. So when we're doing a procedure for them, there's half a dozen people in that room, and our sole focus is making that patient better.